You will enter the referral information into REDCap. You log into REDCap, you click on Tobacco Cessation Intervention 2018 from the project list. Then you click on Add Edit Records under Data Collection on the left-hand navigation bar. You will click on Add New Record. Then you'll click on the radio button in the first row in the column to the far left. Complete the information about you, indicate your name, and indicate whether or not you're an AmeriCorps service member. Complete the information from the email referral. You'll select telephone for the mode of interview. You'll fill out the patient's last and first name, their medical record number, the contact phone number written in the email, the referring provider's last name and their credentials, and the site of the referral. You'll also put in the date and time of the referral. You'll call the patient, and before you do so, you'll document the date and the time you're making the attempt. We'll describe different scenarios. The first scenario would be that you call the patient, they're there, and they're available to talk. So you call the patient, you introduce yourself following the script, you find out it's a good time to talk, you proceed through the script, making sure to document at the appropriate places the type of tobacco, the amount of tobacco, their reasons for wanting to quit, their confidence in being successful, whether or not pharmacotherapy was prescribed, whether or not they picked it up, whether they plan to use it, continue through the protocol, whether or not they set a quit date, what their triggers are and what they plan to do about them, whether or not they want you to follow up, any notes to yourself that you want to see when you call the patient to follow up with them, and then you click yes that you're able to complete the conversation. You change the form to complete, click yes, and save and exit form, and you're done. In the second scenario we described, you call the patient and you're not able to get through. So nobody answers. You scroll to the bottom of the form. It says, were you able to complete the conversation? You click no. Then it asks you, was this your third attempt? And you click no. And then it asks you why you were not able to complete the conversation, and it tells you what to do in the different scenarios once you click these buttons. The third scenario is that you call the patient, they're there, you introduce yourself, and you ask if it's a good time to talk, and they say that no, it's not a good time to talk. So you scroll down to the bottom of the form again. You say you didn't complete the conversation, and this is not the third attempt, and you click that the patient was busy and wants you to call back, or maybe they don't want to coach, but you select the appropriate option and you'll be guided through the next steps.